Bismillahirrahmanirrahim. Assalamu alaikum. In this short video, I'm going to show you how to assess for cervical joint position sense errors, as well as how to rehabilitate a person or a patient who is suffering from cervical joint position sense error. Now, this is very easy test to look for proprioceptive errors. In this video, I'm going to demonstrate the movement of extension and flexion. Similarly, all the movements can be assessed using this method, and then you can rehabilitate your patient. First of all, we would ask our subject to position their head into the neutral position and then perform any movement. For example, the subject has gone for a movement of extension and now she has tried to come back to the original position while the eyes are still closed, and then we need to take the measurement. In this particular movement, we have requested the subject to perform extension from the neutral position with eyes closed, and then once she returns, we are going to measure the distance. So in this particular case, this is 10 centimeter. This is the value in the centimeters, so we will take it and write it down, and then we will readjust, ask our subject to open the eyes again, and now feel for this position. Now close the eyes and perform the movement of flexion, and then try to come back to the original resting position. Now again, we are going to ask the subject to move to the best possible position to the previous level and then measure this value. In this particular example, this was again 10 centimeters, and then the movements like side bending or rotation can also be used. There's a different formula for this to convert this into degrees, and then you can convert this into degrees. The normal variation is about 4 degrees. This error is average. Now we will move to the next segment, in which we are going to use the grid for rehabilitation purposes. For example, we are using a figure of 8 method. This grid is very similar to the grid we have installed over here, and we will be using the same laser tracker. If you can see over here, the subject is requested to follow the lines or the arrowheads on this grid and try to keep the laser tracker within these within this white portion. Now she is trying to move in a clockwise fashion in a figure of 8, and as soon as she performs this, she can finish it, and this is 1 repetition. She has to finish at least 15 repetitions on this grid. Now we can make it more challenging by reducing the width of this white portion. Currently this width is about 6 centimeters, and then we can move to a narrower version which is about 4 centimeters, and similarly we can move to 2 centimeters. The distance between the subject and the grid should be about 90 centimeters from the laser. It should not be more than that, and in this grid we are looking at a smaller grid. The distance between the two black portions or the white thickness is about 4 centimeters. As you can see, the subject has moved out of the white region, so we will start again, and in this way we can train our subjects to improve their proprioception, and this is a very cheap and easy method to perform in our patients, and this is one of the best tool to be used in research as well as in rehabilitation clinics. So I hope you like this video. If you have any comment or suggestions, or if you have any questions, do let me know. Feel free to ask all the questions you have. I'll try my level best to answer you, and I hope you enjoy this video. If you have enjoyed this video, do comment and let me know. Thank you very much.